Inflammatory bowel disease, or IBD, encompasses a spectrum of chronic conditions that have seen a surge in global incidence. Global cases rose by 48% between 1990 and 2019, and projections indicate that case prevalence in developed countries will surge from 7 million in 2021 to over 25 million by 2030. IBD, including ulcerative colitis and Crohn's disease, can start at an early age and ranges in severity, with severe inflammation increasing the risk of colorectal cancer. Some treatments are available, but long-term immune suppressive therapies only work for 50% of patients. In clinical practice, the biomarker fecal calprotectin, or FC, is used for diagnosis of suspected IBD as well as monitoring disease activity. FC offers 74% sensitivity in a non-invasive test. However, a significant challenge emerges, as 30 to 50% of patients return borderline or indeterminate FC results, requiring these patients to be recalled or sent for colonoscopy. Complicating matters, the correlation between FC and inflammation is not linear. This causes difficulty in obtaining a true assessment of gut inflammation without using colonoscopy. Whilst raised FC levels are indicative of inflammation, they lack specificity to IBD alone. Notably, FC testing doesn't effectively detect small bowel Crohn's disease, which makes up 25% of patients with IBD. We have developed a diagnostic product which will address many of these issues. IDxSense can measure granzyme B activity, a novel marker for intestinal inflammation, in human stool as part of a fluorescent immunoassay. The IDxSense test can be carried out in a 96-well plate, as part of the standard clinical pathway for FC testing of inflammatory bowel disease. Importantly, our assay reports signal in calprotectin negative samples. Calprotectin represents the innate immune system and is released by neutrophils, whilst our technology monitors the adaptive immune system via the activity of CD8+ T cells that release granzyme B. By combining FC and granzyme B assay results, we have achieved 94% sensitivity whilst using the same stool sample. Use of this technology as part of the current IBD diagnostic and monitoring pathways would reduce unnecessary colonoscopies and potentially remove the need for additional inflammation tests. Granzyme B is a key protease enzyme found in T cells. It is activated as part of the inflammatory response being secreted by T cells to initiate controlled cell death, or apoptosis of infected or malignant cells. Granzyme B levels are minimal to absent in healthy individuals, but raised for patients with IBD. The IDxSense technology is a fluorogenic peptide, optimized to react with the active site of the granzyme B. IDxSense is the first probe capable of measuring physiological levels of active granzyme B in human tissues, fluids, and live cell cultures. The technology can be used with fluorescent plate readers and fluorescence microscopy, as well as flow cytometry. The introduction of IDxSense alongside existing FC testing will provide benefits for patients, healthcare systems, clinical testing facilities, and pharmaceutical companies looking to monitor responses to new IBD therapies. Every year within developed countries, 16.3 million patients take FC tests, costing £155 million. This presents a substantial potential market for our test, estimated to range between £80 to £220 million for IBD. There is also the capability to expand the technology to other inflammatory diseases. We have completed commercialization studies and preliminary clinical validation for IDxSense, as well as developing a comprehensive team, network, and business model. We've secured intellectual property rights and are looking for further investment. The IDxSense team look forward to discussing this technology with you.